Hello students, I will show a clinical sign of a clinical case probably in the abdomen, which is quite often we have seen, but quite important, otherwise we will miss it. So what this sign is, see that dilated veins here, so much torture dilated veins in the and all of in the front, laterally, everywhere. You can see it is not common like this. So these dilated abdominal veins should be examined in standing position. One, and always once such veins are visible, always check the direction of the flow. Two, the important thing is watershed areas umbilicus, whether it's direction towards the axilla or towards the groin. It's important. Normally below the level of the umbilicus goes to the ascenoiliac vein, above the level of the umbilicus it goes into the axillary vein or SVC. Below IVC, above SVC, superior vena cava, below inferior vena cava. But when there is obstruction, suppose there is IVC obstruction, it flow reverses from below, it goes up along direction upwards towards the SVC through probably subclavian vein or axillary vein, and so direction of flow reverses entirely. It is from below upward, unlike above the level of the umbilicus it is upward, below the level of the umbilicus it is downward, which is normal. So it becomes pathological and abnormal. That states IVC obstruction. In SVC obstruction, it is from above downward, so reverses flow occurs through IVC. Everything drains. So above the level and below the level of the umbilicus, on either way, it is direction is above downward. So 2-finger test. Empty the vein like this, then release. Again empty the vein, release. So find out which direction. Do it on both sides. Above the umbilicus, do it once. Below the level umbilicus, do it once, so that confirm what is the direction. You may do it if there are many veins are here. See that many veins are there. So you can do it on different veins also to confirm and clarify 100% that where exactly the direction. If it is entire thing is below upward, that is IVC obstruction. Entire thing above downward, it is SVC obstruction. If it is dilated veins around the umbilicus, that is called caput medusae, typically seen in portal hypertension. So the three inferences basically you have to remember. I'm not going to have an uncommon thing. It's a common thing, basic clinical sign which you have to remember. So I already told what are the features and causes. Always examine standing position. Flow should be checked above and below the umbilicus, explained properly. Different causes, IVC obstruction, SVC obstruction, portal hypertension is called as caput medusae. I already told. So students, please subscribe my YouTube channel, press the bell icon, and also MCQs are there, like it and share with your colleagues, friends and others, so that they will also have the proper surgical knowledge, especially these short case scenarios, images, x-rays, few operative procedures, specimens, instruments, brief lectures, daily, day-to-day basis, so that for a few minutes, 5 to 10 minutes, you can daily, if you go through that, you can increase your surgical knowledge. And this channel is free, and go through this MCQs, put it in the comment box. I appreciate and acknowledge your answer. And also remember, at regular intervals, we got a live session where students present a case, and discussion will go on with many other faculties other than me. And you can always put your questions and doubts in the comment box, so that you can clear your doubts. And importantly, if you join the live session, you will get a certificate which will be very, very useful for your future career. So please subscribe the YouTube channel. It is free, and like the video and press the bell icon, share with your friends. So students, and also go through my manual of surgery and clinical method in surgery, which entirely covers EBMS syllabus and other things, specialties, everything, with the quotations and CQs also there in manual online. So it will be very, very useful, more than sufficient to learn surgery for PGs and UGs together. So students, answer the MCQ. Corners test is used in A, B, C, D. Put the right answer. I will acknowledge your answer and put the right answer later. The picker position is used in tonsil examination, thyroid exam, prostate exam, seminal vesicle examination. Again, I will put the right answer. I will appreciate the answer later. And quotation of the day is, fight from front, not from behind. You will be like a soldier. Fighting from behind is not a straightforward method. Is what exactly surgeons always should fight from the front. That helps to that actually quotes to the surgeons also. So go through my SRB manual of surgery, my SRB clinical methods in surgery, and SRB's operative surgery 2 volume extensive book which gives every step of surgery with around more than 10,000 illustrations. New edition has come, 3rd edition. Manual of surgery covers all CBM syllabus, general surgery, gastrosurgeries, thyroid, endocrine, breast, and urology, specialty, neurosurgery, cardiothoracic, instruments, specimens, operative surgery, and with the MCQs, online MCQs through the book, and case scenarios with a lot of illustrations, photos, diagrams. So it is more than sufficient for UGs and PGs to understand surgery. So please have my SRB manual of surgery current edition, and also SRB clinical methods in surgery current edition. Everything clinical method I covered, all chapters, all for example hernia, breast, thyroid, general examination, GI examination, kidney examination, urology examination, hydrocele, swellings, ulcer. Everything is covered up briefly, orthopedic also, with the instrument again, specimens, images, everything covered. And each examination, like hernia examination, video of examine hernia is there, breast examination, breast lump examination, video is there, thyroid examination, video is there, peripheral vascular disease examination, video is there. Like that, every system is with the video, with the proper diagrams, lot of photos, and correct method of this one with the K-shaped writing and differential diagnosis in a tabular form, and also with the reasoning why it is clinical analysis. But there is no management because it's a clinical method book. So management concepts are not there. That you have to go through my manual of surgery, and my atlas of tissue approximation 100 book atlas shows brief for properly how to do suturing of different with the video, properly different suturing techniques in detail. So please again purchase and go through my these 3-4 books. It will be very useful, and you can complete your surgical career understanding surgery, both UGs and PGs. And also subscribe my YouTube channel for daily lectures and regular live sessions to enhance your surgical knowledge easier way, because it is free. So students, I hope you understood this lecture very well. Thank you so much.